my medical training at Harvard Medical School, finished in 1993, and trained at Emory for my residency in internal medicine, and that's how I ended up down here. I started knowing Shirley well before, socially, well before getting involved with GNLD, and of course you know how persistent Shirley is. She works on you and works on you. But I've always been interested in wellness and trying to figure out what's the best route to take to help people take charge of their health and be more responsible in getting from an ill state to a well state, which is not easy. And it really is easy to tell people what they should do, but it's harder to give them a pathway to get to that end state. And that's with exercising, with diet, with weight loss, with supplementation. If you don't give them guidelines and direction and make it easier for them, they're not going to be able to achieve those goals, not because they don't want to, but just because they don't know how. So GNLD products really made it easier to be able to give them that pathway and the things that they need to try to become healthier. But I started out practicing out of residency and just straight internal medicine practice, and that was fine. But what I got frustrated with very early on and really quickly was the fact that you're just treating disease. You know, people come in there, all you had time to do really was treat disease, give them their blood pressure medicine, give them their cholesterol medicine, treat their sugars, and send them out the door, and you really didn't have time to approach anything else. Or you had a lot of people who really didn't know or weren't interested in learning how to approach it in a different way, to get rid of their diabetes by losing weight, exercising, supplementation, and things like that. But it wasn't that those people who wanted that type of medicine weren't out there. It's just that they didn't know how to get it or where to go or to get in the right practice to do that. So what I ended up doing was, after practicing a general, regular internal medicine practice, shutting the practice down and starting over. And so I closed that practice down and started a new practice that was a longevity center. And in the longevity center, what I decided I would do was pick and choose the patients who wanted that kind of medicine, because they could go anywhere and get the doctor who would write their prescription for their blood pressure medicines, and who was good at that and knew what they were doing, could give them their diabetes medicine. But what I wanted was people who wanted more than that. Yes, we needed to do their medicines, but we also needed to do these things so that we can start eliminating medicines. You know, so they might come in on 10, we might get them down to 2. We may not get them down for all of them, but there is a way that you can approach it in a different way and help them become healthier. Not only were they healthier, but they also felt better. They felt vibrant. They felt a vitality for life that they didn't feel when they first started. So I realized that you have to have tools to do that, and part of the tools may be your medicine, but it's also your weight loss program and your personal trainer. I have a trainer in my office. He's here today. Offering the products like GNLD, you know, and giving them the guidelines to get there, because they want to achieve those healthy goals, but they just don't know how to. So that actually is a lot more gratifying, practicing medicine that way, because I was getting frustrated, and you're like hitting against brick walls when you're not wanting to be the person who just doles out medicine. But that's all you could do, because you're in a regular practice. You have to actually see a certain number of patients in order to pay your overhead and pay your staff. So it's just like, you know, you didn't have time to counsel them on nutrition or counsel them on supplements or counsel them on weight loss. And what also, you know, the other thing that supplements do, as well as some of the other things that I do in my office, allows me to see fewer patients, because I can make income to pay my overhead by supplements, by some of the fee-for-service things that we do. But my patients appreciate that, because they get the time that they need, they get the things that they need, and they would have been going to GNC to buy these things anyway. So why not get what they need, the right products, the good products that are whole food products and that are going to benefit them, from someone who knows what they need, you know, than go to GNC and pay GNC for these products. And then what that allows me to do is then come back and be able to spend more time with them working on the other things such as weight loss and exercise program, and, you know, trying to help them maneuver through those other things that they need to actually get healthier. So that, you know, that extra stream of income has to be there too, not because, you know, you couldn't do other things like see more patients to make up for that, but because you want the freedom that you don't have to do that. And you can actually take care of your patients in a different way. So my practice is called Eagles Landing Longevity Center, and it's in Stockbridge. And we actually do nutritional products as well as a whole approach, integrative approach to medicine. So it's not that I don't believe in traditional medications, because I do. I integrate them with everything else and minimize the use of them, you know, when you don't need them. So you know, I'm amazed at the people who come to the office and who are on a whole laundry list of medications, and they don't need half of them. You know, all they needed was someone to say, you need to lose 20 pounds, and we're going to help you do that. You know, and then we can come off of 5 of these medications, and all it took was 20 pounds and an exercise program. And you ask them, has anyone ever worked with you and tried to help you do that? No. You know, no one even brought it up, you know, or asked them, have you tried to lose 20 pounds, and has someone given you a program to help you do that? And it's amazing how much better they feel when they do that, and they just need someone to, sometimes just to even tell them they need to do it. You know, not because they wouldn't do it, but nobody ever told them to. You know, just as simple as that. So though getting in a wellness mode just has really helped me enjoy my practice more. I can pick and choose my patients. Some patients I will tell them, I'm not your doctor. You need to go down the street. Somebody else can do this for you. And I feel fine doing that. You know, so because I enjoy my practice. So in that way, I don't have to have anyone who doesn't want the type of medicine that I'm offering. So that's been fun. I also do, like Dr. Smith said, hormone balancing. I use a lot of approaches to balance the adrenals. Like she said, that's so important. You cannot address one issue without addressing everything that's involved with that particular person, including balancing their hormones, balancing their adrenals, helping them with stress reduction, helping them learn how to deal with life, you know. I always tell my patients, you know, you'll always have stress. What you have to do is learn how you're going to respond to that stress. You have the choice as to how you're going to respond to it. You don't have the choice of whether you're going to experience stress or not in everyday life. So that's so important with balancing the adrenals and hormones as well, and we use a natural approach to doing hormone balancing too. So we do all of that there. I could go on and on and on and talk about things, but I want to allow everyone else a chance to talk, and then if you have any questions specifically for me afterwards. Okay.